wow, I love C1 instability. No, honestly, perhaps the most disabling of all the pain conditions that I treat at Caring Medical or that people suffer from, probably the most significant is C1 instability. So I just want to illustrate it. So this is a very small model, but this is the C1 vertebrae, and this is the person's skull. And you can see here that if C1 was unstable, like in other words, it was moving too much, that not only could it pinch on nerves, but it's going to pinch on this blood vessel here, called the vertebral artery. And guess what happens sometimes when you squish on the vertebral artery? You know, you could get vertigo. So if you got vertigo, or you got a friend of yours that's got vertigo, or ringing in the ears, or awful sub-occipital, means headaches like here that just won't go away, or you got migraine headaches that are disabling you and it just seems like nothing helps, you have to think about you got C1 instability. If you want to document that you have C1 instability, you get an x-ray called a digital motion x-ray. You type in on Google, digital motion x-ray. There's facilities all over the country that do digital motion x-ray. And they'll do an x-ray while you're moving. So in other words, people with C1 instability typically have problems when they're moving, and specifically when they do the no motion. Like in other words, a lot of your motion, like 2/3 of your motion of the nodding motion, occurs in C1. Now you could say, well, why is that? So I want to explain that. Now this is a bigger model, and see how there's discs here. See how there's discs here? This is a model of the cervical vertebrae. This is the head. This is C1 right here. This is C1. See this big bone here? This is C2. So on myself, I could go down here, and the first knob of bone that you feel, that's going to be C2. That's that big thing. So if you press on yourself above where that big knob of bone is, and you go above it, and it's really, really tender, if it's really, really tender, that's C1. So that's kind of one way a person could tell themselves. But the vertebrae here, the vertebrae, especially the discs here, this helps stabilize C3 to C7. So it means that there's no disc between the head and C1, and between C1 and C2. See, there's no disc. So it means that these vertebrae are just suspended in ligaments. So in other words, if you have some kind of a trauma to your neck, that all that's holding these vertebrae in place is the ligaments. So I don't know about you, but think of how much stress is on the C1 ligaments. And when I say ligaments, it means the ligaments, that are connecting, the vertebrae here. Think of the amount of pressure on those ligaments to hold your head, which, is 8 to 10 pounds, on that little vertebral segment there. And there's no disc there, so you don't have the stability of the disc there. So it's just the ligaments. And once a ligament is stretched out, it doesn't tighten up on its own. In other words, if you have somebody hit you like you're a fighter, or you smashed down like you fell off your bike, and you turned your head. So if you had any sort of a trauma where you turned your head, that stress is on the C1 vertebrae. So, and when you do a digital motion x-ray, the beam goes through your mouth, and that's where the C1 vertebrae is. So in other words, it's a very hard vertebrae to get a good picture of, but a digital motion x-ray can show excessive motion of C1 on C2. So that's kind of how you document it if you want objective data. And the treatment that we found the best to resolve that's prolotherapy. So I would do prolotherapy to the occiput, C1, C2, and whatever else structures need it. There are occasions where I actually have to limit the person's motion. So in other words, I actually have to limit the no motion while they're getting prolotherapy. So we do that by a cervical collar. So there are times where we have to do a combination of prolotherapy plus a cervical collar. But beside the neck stabilizing, you resolve the, migraine headaches, the sub-occipital headaches here, the vertigo, the dizziness. But C1 instability can cause a host of autonomic problems like tearing of the eyes, nasal stuffiness, racing heart, anything that involves the nervous system. So if somebody has some weird neurologic symptoms and nobody's resolving it and they get different diagnoses, they may want to get a digital motion x-ray and see if they have C1 instability. And if they have cervical instability, then they should consider getting prolotherapy as a treatment to resolve not only the neck pain, but also all the weird neurologic symptoms.